patient first culture. Big box retailers like CVS, Atrium Health. It begins with the medical director, medical practice owner having that vision of what a patient first culture looks like. This goes back to understanding good customer service. Your patients, for lack of a better term, are customers, right? They have a problem that you're trying to solve for them. And it really goes back to really delivering high-level services to your patient populations, because ultimately it's about patient satisfaction. If you own a medical practice, this one strategy could be a game changer to how you develop and move to the future. Medical practice owners, why did you get in healthcare in the first place? This one thing is holding your practice back from growth. Patient growth is the number one cause why a lot of medical practices do not grow. And if you're a medical practice owner, you are under siege right now. You just are having issues with growing your medical practice. There's reasons why. Number one, urgent cares are just growing in unprecedented numbers. By last count, there were 11,250 urgent cares in the United States, with a growth of about 7% predicted. Another area that's taking from your patient growth are all the proliferation of medical spas. A lot of patients go there first in order to help with their wellness, which is great. But there are over 19,000 medical spas in the US alone, and that could hamper your medical growth. The other issue that we're seeing consistently is big box retailers like Walmart, CVS, are looking to get into this game as well. But also you have big corporations like Amazon looking to provide telehealth options for their employees. So these are all taken away from the growth that you could potentially see with patients that need your help. Well, what can you do about it? I have some strategies I want to go into, but first, let me tell you a story. This is a story about Dr. Artis. She is a primary care physician out of Maryland. Dr. Artis takes to heart helping the patient comes first. This is a doctor that goes above and beyond what it means to be a patient first doctor. Not only does she communicate extensively and knows her patients for working with them for decades, but she also allows them to call her and reach out to her with her personal cell phone if they have any issues with their medications. This is going back to a far away time where we had the doctors do house visits with their little bag, meeting you in person to help you with any ailment that ails you. Dr. Artis personifies that type of character. But the big thing that she was struggling with was that she was still seeing patient churn. So once we kind of sat down with her and tried to analyze exactly why were her patients leaving with someone who has so much heart and love for her patients, what was the issue there? Well, we found out that although she had the patient first ideals and vision, that just was not communicated, implemented, rewarded within her organization. Her staff members from the front office to the back office, they just didn't have that patient first culture. And that was something that was struggling with her and figuring out how she can potentially grow her medical practice. So when we sat down and kind of analyzed that and put together a key strategy, she saw tremendous growth, but more importantly, she saw more revenue coming in. And with more revenue coming in, she was able to help her patients even more. Let's talk a little bit about the strategy that we call patient first culture. First, it begins with the medical director, medical practice owner having that vision of what a patient first culture looks like. This goes back to understanding good customer service. Your patients, for lack of a better term, are customers, right? They have a problem that you're trying to solve for them. And it really goes back to really delivering high-level services to your patient populations, because ultimately it's about patient satisfaction. If you have a vision for that, make sure that vision is clear in your mind. Think of the best customer service experience that you've had and think about how you can incorporate that into your practice, right? And that gives you almost like a vision. It's hard to go somewhere if you can't see it first. So having a clear vision of exactly where you want to take this is really going to help you get to that next level, right? And so having a clear vision in your mind, what great customer service looks like, will help you have that vision for your practice. So once you kind of have that clear vision of exactly what does that look like for your medical practice, then you want to be able to communicate that vision. A simple vision could be like a mantra, right? Something simple as our patients get the best care that we're capable of giving, or the best care for the best patients. So you see how we worded that? The way you say it is you communicate it where the assumption is that you have the best patients, so they deserve the best care. So now that communicates to your team that, hey, we only serve the best patients. And so we coming in knowing that our patients are the best. So it's simple things like that with wording that you can kind of communicate that clearly and walking through that strategy, how to best prepare your staff for the visions you have. Now, once you have that vision, it's one thing to have words and mantras, which is great, right? Because that deals with the emotion, right? But you have to have logic tied to emotion. That's only how things get done in any type of organization. And the reason why you think about that is the logic that you think through is understanding exactly what are the standards that we need to operationalize. So simple things like workflows. You're very familiar with workflows when it comes to clinical, but also those workflows are called standard operating procedures on how operations should perform. So having things listed out. So one simple thing is making sure the front office, when a patient comes in, they always greet with a good morning or good afternoon. That one simple thing we have seen has been able to improve patient satisfaction by 25% because you're setting in the ground level, you're setting the foundation for a pleasant experience. And this is what this is, providing the best experience for patients that come in the door. We've also seen making sure on the back office, when you're reaching out from a medical billing standpoint, coming with care and consideration to explain to patient, the medical billing clearly and succinctly, right? And some of those are simple words that you say over and over again, but making sure it's scripted out so the patients understand that. One simple thing we've seen work well as well is making sure you have the billing person explain to the patient prior to exiting the practice to walk through what the expectations are for billing. So they have no surprises, so that the patient doesn't have any surprises about what's happening with their medical billing long term. And so this is something we've seen work really well. One best practice, dentist offices, we've seen do this a lot, where you have your procedure and then they walk you through the expectation for the billing, but more importantly, what happens if you owe anything and what that looks like. Just explain the process can help ensure patient satisfaction levels by close to 30%, because the goal is to ensure that the patients are comfortable in any kind of communication. Once you have the vision, once you have standardized around standing operating procedure on how to communicate and how to implement that vision with the staff, next you want to reward it. Rewarding is simple. Having these simple strategies around how you're going to implement the best patient-first culture is by making sure you have what they call KPIs, key performance indicators, making sure you have key things that you reward people on, the culture that you want to reside in. For instance, one of our mantras inside my organization is having a mantra of collaboration comes first. So that means if I see anyone, or we as a group determine that as individual within the organization, which is very collaborative, right? That's really helpful, guiding everyone and building everyone up at the same time. And there's a special quarterly reward that they get as a collaborator. And this is something that you can do with your team. If a patient first culture is about making sure you provide a better experience, then you want to make sure those experiences that you've listed out are clearly communicated that to the team, and making sure you highlight the individuals that are displaying that behavior and rewarding them, because behavior that's rewarded will be repeated. Again, behavior that is rewarded will get repeated. And what you want is a consistent experience, high-level experience that can be repeated over and over again, and that will maintain and build on itself, because then you have the best patient experience. So who am I to kind of talk a little bit about this and kind of explain to you? Well, my organization, SensorMed, we work with hundreds of medical practices across the country and deal with tens of thousands of patients. And the key thing we've seen is the ones that have the best experience will keep their patients the longest. We've implemented a lot of the strategies that we teach our customers and clients inside our own organization, because we understand clearly how to provide experiences for the practices that we work with. We try to maintain high experiences from onboarding to communicating to their patients, to even when we discharge patients from the programs that we offer to our practices. We want to make sure we have that same level of experience. And we've done this with hundreds of practices and with large organizations like Google and Atrium Health. We've worked with tons of different organizations to understand how to create this best experience, which unfortunately in healthcare is not always the case. And so the key there is making sure you maintain a standard of care to ensure your patients are comfortable and feel like they're part of a bigger organization that cares cares about them, and you will have less likely of churn or patients that leave the practice because they didn't get the care that they wanted. But not only does it help with, keeping patients, but it also helps with, guess what? Getting new patients, because if patients have a great experience, they're going to give you great testimonials. And those great testimonials, if anyone who's looked for a doctor has seen, you go to Google, you look at all these testimonials, you get 5-star reviews. That's one area. You're attracting new patients to your practice. Another area, a lot of insurers, a lot of value-based care programs have a patient satisfaction score or quality score. And there's surveys they send to patients to determine how well was the experience they had with you. And these incentives can be financial benefits, or they could potentially take away revenue from you if you don't meet certain standards. Having this patient-first culture is so key in making sure you maintain and grow for the future for your medical practice. In summary, these are the things you can do to be successful. You definitely want to make sure you have that vision for your practice, making sure you have a clear understanding of what you need to do to be successful in growing your patient populations and understand what that patient-first culture looks like. Next, you want to be able to standardize this vision, making sure you have it written down clearly. Everyone knows exactly what they need to do, from front office, back office, clinical, even some of your vendors that you work with, making sure there's consistent high-level standard excellence of care to maintain that patient-first culture. And third, you want to reward behaviors. Rewarded behaviors get repeated. Honestly, making sure that the individuals are consistently meeting those standards so that you can grow your medical practice to unheard levels. Try these strategies below. If there's any way we can help you how to implement these at scale, check in the links below. We can kind of walk you through some of the strategies we've seen being extremely successful implementing these. But try them today. Comment below in the comments and stay tuned for the next video on how we can help you grow your medical practice in this new normal.